And we do those from the age of 50 to the age of 75. And sometimes people can be screened earlier than the age of 50, depending on any sort of family history, any sort of risk factors. A screening test are various tests that we can do in the outpatient setting to catch any chronic illness before it becomes a problem down the line to better your health. Screening tests are fairly accurate. There's a lot of research and evidence that's gone into making preventative screening tests. I think it's best to address any issues that you may have with your primary care provider. There are screening tests recommended for children. I would definitely recommend following up with your pediatrician or healthcare provider if you have any concerns. Screening tests that are recommended for all adults would be a colonoscopy starting at the age of 50, and we do those from the age of 50 to the age of 75. And sometimes people can be screened earlier than the age of 50, depending on any sort of family history, any sort of risk factors. Lung cancer screening is recommended for anybody 50 years of age to 80 years of age. And we recommend this in anybody who has been a 1 pack per day smoker for at least 20 years. Even if this person has quit in the last 15 years, we still want to do a once annually low-dose CT scan of their chest to check for lung cancer. Diabetes screening is recommended between the ages of 35 and 70, at a minimum every 3 years. Depression screening is recommended for everybody 12 years and older, at least 1 time annually. STD screening can be done starting at the age of 16 to the age of 65. Depending on a patient's risk factors would determine how often you need to be screening a patient for any STDs. HIV screening is done from the age of 15 to 65. It is a one-time test that we recommend at any given time between those ages. If you are a person in a higher risk group, we would recommend more consistent screening for HIV. And for hepatitis C screening, we recommend a one-time screening between the ages of 18 and 70, at least once in your life. If you're in a more high-risk population, we recommend a more consistent screening, and we definitely recommend you reach out to your healthcare provider for that. For adult males ages 65 to 75, we recommend a one-time screening for abdominal aortic aneurysm if you've ever been a smoker. And if you're an adult male who has any questions about any preventative screenings, please reach out to your primary care provider. Cervical cancer screening is a screening that we recommend for all of our adult women aged 21 to 65. We never want to screen any female younger than the age of 21. From the age of 21 to 29, we screen every 3 years. And then starting at the age of 30 to 65, we screen every 5 years. However, the screening years might vary depending on your particular test, and your provider might ask you to come into clinic maybe earlier than the 3 years or 5 years, depending on your test results. Breast cancer screening is recommended for our adult females aged 50 to 74, and that's a USPSTF recommendation. In our adult female patients, 65 and older, we do recommend a bone density scan. If you don't have a medical care provider, we would love to see you at the Emanate Healthcare Center, where we have providers who specialize in family medicine, pediatrics, OBGYN, and a multitude of other specialties.
If you like this video, please give it a thumbs up to help more people find this important health information. Click the subscribe button and the notification bell for access and reminders to more Emanate health videos. We upload informative video content every week.